Yes, welcome. It was a request that I do menopause, and I had promised I'll do it today at this hour, so that tomorrow when I'm talking about the other topic of the day. There was another request. So, Kingre, welcome. I had promised I'd tackle menopause right now. People had asked I do menopause, so we will do shortly menopause. So that tomorrow there was a request before I start the topic. I do. There is someone who is. Let me check. The see see. Okay. Someone asked me to talk about hives. So I'll do tomorrow hives before we continue the topic of the day. But right now, if you are the one uh, who asked for a topic called menopause, and this is the topic, let me add something here. Uh, Let me add something here. So, what do you understand by menopause? What do you understand by menopause? Kwemba, hello, my namesake. Welcome to the platform, my namesake. Um, Someone asked we do menopause, so please, if you are there or you know the person, please let the person uh, avail herself. Let's talk. Let's continue talking. Okay, what do you understand by the term menopause? Some people get confused and they say uh, some people get conf- some people get confused and say it's a disease. It's a disease for people who are old age. Is menopause really a disease of people who are old age? Hmm? Tell me if you understand what menopause is. Hilda Taylor, hello Benjamin. Blessings to you and everyone. Big up, enough love and respect. Hilda Taylor Okwemba, thanks, welcome. There is a question that I've put up. Is menopause really a disease for people who are old age? We want to learn. We want to learn and know if it is a disease for old age. Okay, as we continue, always let your likes flow. I can see cute Jessie. Cute Jessie, today you're here. Cute Jessie is always a smiling lady, and she's always jovial. So today I'm coming late at night. Kenyan time right now it is 10 at night. Imagine there was a request. Don't just leave. Give me a like. Give me a like as you watch, as we talk. It's a stage of infertility. Cute Jessie has said menopause is a stage of infertility. Someone else, what is menopause? Please, it's a stage of infertility. We want to learn. We Someone told me we talk about menopause, and it's a request, and I'm here because of the request. When someone requests you, this thing has been uh, disturbing the person, or this person wants to know more about whatever that you can help. So I'm here, we discuss and we know. So menopause is a permanent cessation of menstruation resulting from loss of ovarian follicular activity. Where the follicular activity releases an egg, and when it releases an egg, if it is not fertilized, there is no implantation. But if it is fertilized, there is implantation. So this is the cute Jessie has said this, the truth is a stage of infertility. When I'm saying permanent cessation of menstruation, eh, and ovarian activity, it means the wall of the uterus is not furling off, it's not coming out. So it is diagnosed after 12 consecutive months without a menstrual period. Yet imagine you stay 1 month without period. Today, It is a talk for the ladies, and the men that are in the house will accompany and hold them. The men that are here, give the ladies hugs, give the ladies hugs. Make them feel they are the most important things in the world. Yes, human beings in the world, the ladies. Yes, menopause is a permanent cessation of menstruation resulting from loss of ovarian follicular activity. And you know, when the ovary is not functioning, you will not have the hormones that are needed to balance so that you start have menses. Menses means menstruation, it marks the end of menstrual cycle. Yes, menstrual cycle means the walls of the uterus flaring off, coming out, so that another new layer generates. You see, if you have sex and then the egg from the follicle comes and they fuse, conception happens, there is something called implantation. When implantation comes and then the zygote goes in the wall of the uterus, progesterone hormone rises. When progesterone hormone rises, what happens? You cannot have menses because progesterone makes the walls of your uterus tough. So there is no flaring off of the uterus. You understand? But if there is if there is no if the process is not there, and then you have something called oxytocin surge, that is where the wall becomes supple and it flares off. And then there is some hormones and some chemicals that makes that wall to come out without bleeding. If you notice, menses don't clot, but blood clots. So there are some chemicals that comes in with the menses that makes the menses not to clot. So the wall comes out very well because oxytocin has taken place, progesterone is not there. Let's continue with liking and sharing our platform here. Let's continue with sharing, 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 sharing. Sharing is caring. Platform. Anyone who can post some references and some channels here, please continue sharing. And please, as you like it, today we are talking as ladies, ladies in the house, experiences about menopause. So we continue, and it is diagnosed after 12 consecutive months without, imagine staying 12 consecutive months without menses at the ages of 45 to 55. So when you are getting to 40, 41, 42, 43, the symptoms start to occur. Yes. And averagely, many women around the world is 50. 50. At the 50th year, you start having those issues of hormonal imbalance, mood swings. We will see what is why you get them. Now, types of menopause. We don't just have menopause, eh? We don't just have menopause, ladies. Come on. There are several types of menopause. Let's learn the types of menopause. How menopause comes. What categorizes this menopause as this type? Our beautiful, lovely ladies. As you grow up, you become so nurturing, so caring. But at some point, you start having, you understand. You get it? Now, types of menopause: natural menopause, premature menopause, induced menopause. Some people can induce menopause for themselves. Eh? Hey, just imagine. Please hit that like button. We are watching, and let the likes go on. Let the likes go on. Let the likes flow. Let's interact. Hmm? Have you ever seen someone who is in menopause doing something and you ask yourself, why? Share it with us. Now, what is natural menopause? Occurs due to age-related decline in ovarian function. So when you get to 40, the follicular phase, the follicles start to seize. And you know, the follicles produce something called estrogen. That's why you speak like a lady. Hi. Eh? And I speak like a man. Hi, because of I've got testosterone and you produce more of oxytocin in your follicles. Yes. So when they cease to produce, when they cease to produce, you get it, oxytocin hormone, what happens? Yes, you love laughing. Eh? I love it when you feel happy. So when they cease because of age, some things have gone down, some hormonal uh, balances have changed. That is where progesterone takes on. And now the wall that was coming out because there is no implantation stays there. You get it? But there are some problems that happen even in that. So natural menopause occurs due to age-related decline in ovarian function, and mostly decline in ovarian function is linked to hormones, because hormones are the ones which tells you we are going this direction. Luteal phase is here, let's do this. Follicular phase is here, remove oxytocin. Now, luteal phase, there is a pregnancy, but there is a pregnancy here. Hey, bring progesterone, let's take care of this pregnancy. Progesterone takes care of the pregnancy not to come out. So if a man has a lot of oxytocin, and that's where you hear men talking as women, because maybe they have a part in their body which is producing this hormone at high level. So we are talking of menopause. When the follicular follicles stop the cessation of producing these hormones, you get what? Menopause. And then that is the first natural menopause. Natural menopause. We have another one which is called premature menopause. Premature menopause occurs between ages 40, and this one is created. Ma JB, welcome to the platform. We are increasing in numbers, and my likes are just stagnant. People don't like. If a person is not hitting the like button, it means people don't like issues concerning menopause. Let's appreciate its life. Greetings, Benjamin, and everyone. Welcome, Beauty. Always beautiful from South Africa. A lovely lady who loves smiling. Beauty loves smiling. Please check Beauty on Instagram. You'll smile even you. Now, there are some causes that bring premature menopause. One of them is genetic factor. You are brought up with a genetic factor that makes the follicles. Guys, kindly connect with me. This topic is very nice. Yes, yes, cute Jessie. Follow cute Jessie hand in hand. Give cute Jessie some drumsticks from chicken that are fried. Like the videos of cute Jessie and subscribe. Yes, we are here to hold each other's hand. Now, I'm talking about menopause. The first one was natural menopause. The second one is premature menopause. Genetic factor is first. In genetic factors, what happens? You are born with a genetic factor that follicles wither faster. Follicles wither faster before the ages that are needed. We call them premature genetic issues. Autoimmune disease. We have so many autoimmune diseases that cause menopause. If you are here and you have had someone who has menopause, just a minute. Autoimmune immune diseases. Yes, if you are here and you are having someone who is undergoing menopause issues, please talk to me. Autoimmune diseases that cause menopause. Don't worry, guys, I'm still going on with my flu. and it is at least going out. It's going out. Let's interact. Only 4 likes, guys. 4 likes. No, come on. Let's do better. Let's do better. Now there are some autoimmune diseases that cause menopause. Yeah, there are several, like Addison's disease. Addison's disease it destroys the adrenal cortex that produces the sex hormones. Eh? Adrenal glands produce small amount of sex hormones. So when this gland has an autoimmune diseases, you get you get menopause. This one, it's because it is premature menopause. Yeah, there is something called Hashimoto thyroiditis. The thyroid can cause you to have early menopause, thyroid disease. There is something that people talk a lot that is called lupus, SLE, systemic lupus erythematosus. That one makes people to get menopause, systemic lupus erythematosus. It makes people to get menopause. People with diabetes mellitus, they get early menopause. People with rheumatoid arthritis, because it's autoimmune, the follicle die faster. Autoimmune polyandrine syndrome. Autoimmune polyandrine syndrome, people get this faster. My friend Margaret in Norway. I was in Margaret in Norway's live and I liked it. Margaret in Norway. Hey, I'll do a live with you one day. Now, those ones are the autoimmune diseases. This is how they do. They affect the ovarian follicles, hormone producing cells, endocrine glands control, loss of ovarian follicles, and increases follicle stimulating hormone and luteinizing hormone. And then you cannot have the normal cycle. I think I should find time and explain the circle so that people can understand this. Now, we continue chemotherapy. People that are sick on cancer and they are undergoing chemotherapy. You know, chemo and radio kill some cells in your body. So you will have a premature menopause. Before 40 years, you start having menopause. Surgical removal of ovaries can bring menopause. Please, let's like the video and share it to someone who is undergoing, like the live stream. Yes, Margaret, please. Margaret from Norway, a very pretty lady who loves smiling. And I told her she has a good smile. Yes, I can see Beauty Simba in the house, Gertrude, Kingre, all of our friends are in the house. If you are here and you are in the other group, please support your friend. Now, those are conditions, causes. We have said causes of premature menopause. You are less than 40 years and you are having menopause issues. Genetic factors, autoimmune disease, chemotherapy, radiation therapy, surgical removal of ovaries that can lead. And then now there is something called induced menopause. Occurs due, it occurs due to medical or surgical intervention. Sometimes surgical intervention, when it comes to, you can have problems with the ovaries and then they remove it. And then they remove it. You get it? Chemotherapy, pelvic radiation. There are so many organs in your pelvic, like the lymph nodes, all those. They can have cancer, then you start going for radiotherapy, and then you get induced menopause. You get it? And there are some people who don't like having babies. They'll go and remove their uterus. Yeah, infertility, that is infertility. So you'll be undergoing menopause. Now, stages of menopause. Let's start. Let's start here, my fellow girls, my fellow friends. These are the stages of menopause. But if you have a question, you are not understanding something, please ask me. Ask. There is someone who requested really for this topic. Hope she'll get it. I can't remember the name, but it's called someone. I remember. I'll find out. Now, stages of menopause. Premenopause. At Dr. How good is radiotherapy and chemotherapy? How good? You see that question? How good is chemotherapy and radiotherapy? Now, when we are talking about radiotherapy, what are we talking about? I'm answering Gertrude Lumbasi. Gertrude Lumbasi from my motherland. We come from the same place. Now, radiotherapy means you'll be subjected to X-rays to kill cancer cells that are spreading. We call it metastasizing. You get it? You kill cancer cells that are metastasizing. It's like slowing the cancer. Slowing the cancer. Just a minute. It is like slowing the cancer to go on and on. Chemo is a drug. Chemotherapy is chemical therapy, drugs that are induced to your body to destroy and target the cancer cells. So the variation between better and not better depends with the staging that you are in and the type of cancer that you are undergoing. Gertrude Dumbasi, I think but does it help in cancer patients? Yes, it depends. I'll talk about cancer. Let's get time. Maybe we talk about cancer. It helps, Gertrude. It helps because if cancer spreads fast, loss of life is imminent. If cancer can be eliminated or we stop it to go faster as we find a way to save life, it is better. So Gertrude, it helps. I will talk about cancer. Let's talk about menopause. Menopause, and we are at Gertrude. Have I answered? I think I've tried my best, but we have a topic of cancer, and it will come. A month that will come, we will talk about it. Now, stages of menopause, transition period between menopause, characteristics, hormone levels fluctuate. Like you'll find estrogen very low, progesterone is high. Yes, Gertrude, yes, I'm asking because I have a sister who is undergoing the same in India. Gertrude, you have my number. I think the number, you can inbox me, we talk. Yes, I will explain more. Perimenopause. Yes, perimenopause. Kish has said, I did my hysterectomy a year ago, and since then I went straight into menopause. My mode is all over. I'm not feeling my old self, but as a Christian, I always think positive, so I do self motivation. Yes, when you when you do hysterectomy is removal of the uterus. Some hormones surge and some hormones drop. So you may feel younger than before, and even the body weight may come, and some issues may arise. So that is it. Please like my video as we continue. And today people are not posting their channels. You don't want us to follow you. I want to follow everyone. I want to follow everyone. So post. Now, perimenopause is transition before menopause. Irregular menstrual cycle. Sometimes they come as dots, sometimes they don't even come because of the hormones that are fluctuating. It appears 2 to 10 years during 2 to 10 years. That is, when you get to 35, you start counting. When you get to 45, you can start counting. Maybe you'll end up to 50. So, two to how old? To 50 years. 2 to 10 years. Now, the second one, the stage now is the menopause itself. You see, we are from hormonal imbalance to the stage itself, which is the menopause. The menopause itself, the point when menstruation stops completely, it stops completely, and we have said you stay 12 months without menstruating. 12 months without menstruation. And then we go to postmenopausal, because after menopause, you should have a period after menopause itself. Because you see, this is hormone surge, hormones getting high, hormones coming down. The stage past menopause for the rest of the life now. Hormone stability at low level and risk of some diseases increase. You get it? Now, because I'm talking about hormones, what are the important hormones that are involved? I'll go slowly because some names of hormones are complicated, but I'll try to explain how they go. Now, the hormones that are involved are, let me put them there so that someone can read. The hormones that are involved are those ones: estrogen, progesterone, follicle stimulating hormone. Yeah. How does hormone relate to climate? Imagine I get menstruation cycle when I'm about to winter or summer. In my motherland, I used to get a normal. I went for checkup, nothing was found. Cute Jesse, I'll explain. I'll explain that. Let me just go through this, then I'll explain. Estrogen and progesterone are the main hormone, but kish, we have some other hormones like follicle stimulating hormone and luteinizing hormone. You get it? So follicle stimulating hormone is the most important. I'm doing something here. Is the most important because it is the one which stimulates the follicles. You get it? It is the one which tells the follicle, this phase has gone, let's do this now. You get it? I'm still in my 20s, imagine. Imagine. I will talk about that. Let me finish about the mechanism and then I come to your question. Uh, Cute Jesse, then I come to your question. Now, aging ovaries lose follicles. Ovaries produce less estrogen and progesterone. The brain tries to stimulate ovaries. You see how they work. When greetings everyone, Barbara World, wake up. The brain tries to stimulate ovaries. The pituitary gland releases more follicle stimulating hormone and luteinizing hormone. Ovaries fails to respond because of the aging ovaries. A tree that is producing fruits and the buds are withering. You see, ovaries fail to respond. They just fail to respond. So, what is the outcome? Please, if you are coming in like as always, what is the outcome of ovaries that are not responding? What is the outcome of ovaries that are not responding? Follicle stimulating hormone will be high. High levels of luteinizing hormone from the pituitary gland of your brain. And then you'll have low oxygen, low estrogen. Low estrogen means you cannot have menses and you are not fertile. Dr. Ben mean when one is passing through menopause, they are prone to a lot of diseases. Yes, I'm just about to talk about it. Now, I've said the mechanism. The brain in the pituitary gland produces follicle stimulating hormone and luteinizing hormone. But the ovaries are not responding because they are not alive. Yes, they are not alive. Let me use that. So you have a lot of follicle stimulating hormone, but you cannot produce estrogen that is needed for you to have the cycle, menstrual cycle. Let me now answer cute. Let me answer cute JC. changes in daylight, and hormonal problems. During winter, most of the time, the body produces more melatonin. Melatonin increase slightly suppressed reproduction. You see, melatonin is a hormone that is produced in your brain. And when it is produced in your brain, what has happens? Estrogen, progesterone, and luteinizing hormone and follicle stimulating hormone, what do? They get confused. You know why? They change the timing of ovulation because follicle stimulating hormone stimulates the ovaries to start the process. Luteinizing hormone changes to stop the other process of menstruation. So, what happens, my dear friend, cute Jessie, who is at still in her 20, when you go to during winter, a hormone called melatonin and others, they are produced to keep you well, and they force a surge, and that surge suppresses estrogen, it suppresses progesterone, it suppresses luteinizing hormone, and it suppresses follicle stimulating hormone. You see, it is a mechanism to help your body by producing these hormones, but in another way, what happens? They interfere with your hormonal cycle. Another thing, temperature changes. Temperature changes. Thank you so much, Dr. Benjamin. Welcome, China, Mary Simba. Welcome. I'm answering our young girl called. I'm answering our young girl called Cute Jessie. She's confused why when it is winter, she gets an imbalance. You see, light exposure affects hormones such as melatonin. You get it? And you see, listen to this. The menstrual cycle is controlled by the brain ovary hormone axis. So your menstrual cycle starts from the brain. And that's why eh, during winter, what is produced? A hormone called melatonin to protect you. And it stops, it suppresses those hormones that are supposed to balance so that you have the cycle. You get it? So let's continue and say temperature and metabolism changes in your body, because when it is so cold or so warm, the metabolism changes. When it is so cold, metabolism increases because your body needs warmth. May increase dehydration, extreme heat or cold, may change electrolyte balance, can stress your body. You get it? Yeah, I had to go to the uterus scan. I was shocked. It was normal, but nothing was found. Now, cute Jessie is appreciating why nothing was found. That is why nothing was found. So, in cold climates, the body increases energy use to maintain temperature. Stress hormones may increase. You get it? Like adrenaline may increase. Gertrude, don't pray for it to can feel like you are going mental. Hot flashes, headache, reduced bone density, sweat at night, etc. Yes. So, cute Jessie, you understand? Stress of relocation or climate adaptation. Because when you move somewhere and psychologically you start to adapt, there is something called hypothalamic pituitary ovarian axis from your pituitary gland. It changes the regulation, and you've said it releases some hormones like melatonin that makes your hormones to have imbalance, because some hormones like melatonin, dopa, they suppress follicle stimulating hormone. So Jesse, you see how it goes. I think I'm at least sharing this to you. Please, as we continue, as you're coming in, anyone have the like button. And then changes in lifestyle. Maybe when you went where you are right now, the diet changed, you changed sleep pattern, and you you sleep pattern, melatonin is equal to sleep. So if melatonin is increased, you understand. If you are sleeping a lot, you will lose what? Menses. But if it is normal as you lived here, the menses will come. And then we have vitamin D changes. Sunlight exposure affects vitamin D. Low vitamin D may affect ovarian function and menstrual regularity. So, if it is you are in a cold place, you are likely to have low vitamin D. You should be having foods that have vitamin D. So, you have understood that low vitamin D is a problem when it comes to ovarian functions. You get it? And then we have cardiac rhythm changes. That one we talked about in the mental health. If you go to my mental health playlist, go read. I will not talk about cardiac rhythm. Go check biological clock that is called circadian rhythm. You will understand more about changes in hormones and menstruation. Now we are at menopause. We are continuing. I was answering cute Jesse. Since I understand my menopause, it is not that bad. Yet diet have a lot to do with it. Yes, Cherry Simba diet has a lot to do it with it. Even before I talk about signs and symptoms of menopause, Kish Kish had already talked about it. Everyone knows. Give me advice how to handle it. I'm about to. Gertrude, don't worry, I will talk to you. Gertrude, it affects people in different ways, but some symptoms are really bad. Now, hot flashes, night sweats, flushing, and palpitations. Palpitations can cause instability in hypothalamic temperature regulations due to low estrogen. You know, estrogen balances your temperature. It makes you have a supple skin. That's why you will find that women are, when you look at a woman, the skin is supple with more fat, but a man has muscles. You get it? So this one maintains the flow of hormones. And let me tell you one thing, hormones are steroids. Hormones are steroids. That's why they work. But when they are not, you don't have enough fat. Don't ask why women have more curvaceous shape with supple skin and some good fat. When you touch some of them, you feel soft. Eh? It's because present Dr. Mercy Grace, good, welcome. Do alike and let's continue. When you touch a woman and you feel, is there some prevention? Prevention of menopause. Let me laugh slowly, but let's see if we have prevention. Let's continue. Let's continue. Sage plant helps to reduce night sweats and hot flashes. We will know. We will talk about how to manage. Don't worry. We are going slowly by slowly. Uh, I've said a woman is estrogen. The body of a woman is steroid, and steroids are produced from fats. So oxytocin makes this woman to regulate hypothalamic temperature regulation and hormones to have the right temperature to undergo the hormonal balance and regulation. Yeah, you get it. So we are going on. Please don't just watch. Like as we go. Like as we go. The menstrual changes may be irregular before when you're getting to. I'm currently on evening primrose. I took my vitamins D and etc. Very well. That is nice. Now we have talked about hot flashes, night sweats, flashing, and palpitation. Palpitation is when you hear your heart beating, pa 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 pa, and then it stops, and then it stops. But the other way is this: irregular periods, heavy bleeding, missed cycles, eventually complete cessation. We call it menstrual changes. And then we have symptoms, psychological symptoms. Yes, today you are so happy doing everything with your friends, everything. But after a day, tomorrow, can I get some tea? You look at mood swings, hmm? Stone face. Happy hormones are not there. Serotonin is finished. Dopa, eh? Pleasure hormone, dopa, is not there. It is gone. So the happy mood has gone. Those are mood swings. Anxiety, depression, because now it is you say life starts at 40. 40 is the transition between facing the real challenges of uh, a person from the childhood. How you prepared yourself from the 30s and facing the challenges. Good topic, Dr. Ben. I'm learning a lot. You see, so at 40 and you are undergoing mood swings, heavy menses, missed cycle, happy hormones come and go. Happy hormones are serotonin, dopa. Pleasure hormone is dopa. That makes you look at your man like this and feel, wow, that chest is nice. Man, I got the right. Man, can we go to the bedroom? Man, dopa is the happy hormone. It is not there. It is not there. And now you are feeling confused, and even feelings to men are going. Your man is confused. Why is my woman not touching me today? Yes, you understand? Happy hormones are going. Please, we are just stagnant to 8. 8 likes, man. Let's increase them at least 10 plus. 10 plus. Yes. I hope I'm talking in a good way with my fellow ladies, my fellow good ladies. Hope my language is not bad and it's not making you feel bad. Sometimes I may talk and you feel bad. Please tell me, doc, there I'm feeling that you are touching me. Hmm? So, irritability. Where is my shoe today? Do you think I walk everywhere with your shoe? This lady is always irritable. Sometimes, not always, because these are psychological symptoms. Irritability, easy irritable. Can we go to the market today with you? Can't you see I'm tired? You go. Irritability, psychological symptoms. When you are here and you are a man and your woman is doing this and you are feeling, don't get mad. Do this. Let me give men a secret. Go to the supermarket, get chocolate with flowers. Get chocolate with flowers. Sing a song. eh? Sing a song. If you don't like singing, place those flowers on the table. Place those chocolates there. Let your woman see it. She'll be irritable, but the irritability will sublime. And the smile will come again. You see, you'll be bringing back the aura. I'm talking about men. Men, I'm helping you on how to deal with your women when this time comes. Please clap for me. Don't, does it pass at some point? Yes, it passes. Menopause, we have post-menopause. Eh? Don't don't say I'm an African man. I'm a man of the house. When I'm talking to you, speak to me. Hey, be gentle to your women. Buy some chocolates. Kiss this woman on the cheek. Tell her bye. Let me go do shopping. I'll be back. You get me right? Very important. I'm giving you secrets. And then let me continue. Memory issues at menopause, sometimes because of the confusion and hormonal imbalance in your brain. How long does it take? We are going to see how long does it take. Yes, you have memory issues. You forget easily because of the easy irritability, because of several things. Chocolate, they say, contain magnesium, which helps during menopause. Kish kish. Come on, my brother. I know these things help. Chocolate with magnesium. Magnesium is the key component when it comes to neurotransmitters And when they take it, the hormones, the dopa hormones that are happy hormones and the good hormones starts to manifest. The brain fog starts to go away. You see how we are learning slowly by slowly. Yes. Now we continue. You have said memory issues. We have menstrual changes. That one we have talked about. Psychological symptoms like mood swings, anxiety, depression, irritability, poor concentration, and memory issues. But now there is something called sleep problems, like insomnia, frequent waking up, and poor sleep quality. Because if the melatonin and serotonins that are they are not there to bring sleep, the cardiac cycle. I've said I did a cardiac cycle in my mental health. Please go and learn about it. If these hormones are not there, you will have sleep problems, and sleep problems is an avenue to depression. Sleep problems is an avenue to depression. And that is when, thank you, Kish Kish, I'll start now. Sleep problems is an avenue to depression. And this is where we do what? We need to start helping our women when they are in menopause. Hmm? You don't stay outside, you stay outside, your woman is 40s, 45 going, you are always working. You are not even having time to her. You don't offer a shoulder to lean on to say, baby, I'm here. Eh? To say, babe, I'm here. Eh? Take that head, stimulate it. Let this woman feel the presence of you there, even if she's irritated. Listen to your woman, even if she is shouting. Yes, you will help your woman to overcome menopause. And then there is something called urogenital symptoms. Now, this is where we have problems. Urogenital. When I'm talking of urogenital, I'm talking, hey guys, are you really surprised until my likes have stopped? I'm talking of bad things. Oh my God. Oh my God. The problem is we have to educate each other. Please raise the likes. Raise the likes. Let's raise the likes, man. We have to educate each other. One of the problems here comes when I'm talking of urogenital, I'm talking of when we down there, the vagina. The vagina. The vagina becomes dry. The progesterone that is supposed to be there to make it supple and bring some cool waters, the slidey waters, is not there. Yeah? And during intercourse, you get something called dyspareunia. Hi, you feel like I'm not feeling my man. Man, I'm not feeling this, man. I'm like, you please get out of me. Let's just talk. Then your man thinks you have started cheating or thinking of someone else. No, this pareunia is there. Pain, dryness. Eh? Eh. You think having making love, making love is feeling romance. Before you start it, you are wet. Eh? You look at your man and you say, hey baby, I'm looking at you and I'm seeing for the last 45 years, you are the most beautiful thing that I've ever seen. Yeah. Your man says, come on, sweetheart. You know what? I just got gold like 45 years ago. And then you become wet. And then wetness, you swim. Let me not dig deep on swimming. The best way to handle menopause: eat balanced meal, calcium and vitamin, drink plenty of water, stay active, improve sleep, and the list goes on. Yes, Mary Simba, that one. Barbara is saying what I have. Yeah, it's a topic I'm learning a lot. Very important. As we grow the numbers, please like. Eh? So I'm giving the natural way of making love. There is making love and there is having sex. You with your partner, you are Are you attacking me? You with your partner, you should be making love, feeling the mood, becoming wet, and then swimming. But where we are not doing that, it seems there is a problem. And this is 45 and above, and you are having pain during intercourse. I will teach you how to bring back the wetness. So, if you are dry at the vagina, you have high levels of bacteria to come in. And when the bacteria come in, what happens? When the bacteria come in, you start having itchiness. Come on, guys, why are you making me not to get the likes? Or am I talking bad things? No, I'm educating people. We are more than 10 and only 8 likes, man. Give me the likes, brother. Like men who are here, men who are here. I've just told you how to breathe to make your woman feel good when they are in menopause. Sometimes I wake up very moody. In a way, I don't want to see anyone near me. Cute Jesse, you are in your 20s. We are not talking about you. Cute Jesse, you are still in your 20s. You should be lively. We shall talk to you and why. We are talking to people who are above 45 now. Yes? Cute Jesse. Okay. But I understand you changed the environment and the environment is hitting you hard. So, we continue with urinary urgency. You see, when your vagina is dry, what happens is more bacteria come in, and then you start having urinary infection, recurrent infection. But when your vagina is supple and having fluids, those fluids contain some prostaglandins and some chemicals that kill bacteria. So let's know that being wet when you are walking and you are looking at your man and you are starting to be wet, it helps. Having sex when you are wet, it helps. The fluids help to kill bacteria and enjoy sex and enjoy making love. I don't like saying sex. Yes, UTI drink cranberry juice. Yes, I say the fluids that come when you are making up, they have some chemicals that kill some bacteria. Dryness is a very common during menopause because estrogen levels drop. Yes, and we will see how we can make you be supple when you have dryness. Yes, we continue. Urinary incontinence. Incontinence is bad when it comes to urination. It makes women feel so bad. It is painful. And sometimes you just feel like the urine is coming out. You see, it makes women have depression because when we can't hold your urine, you see, it's a problem. Sometimes I feel pissed off with anyone and so bitter. Imagine, cute Jesse, I will talk to you. I'll talk to you. If it is in private, it's okay. But if you want us to talk publicly about that, it is also okay because we are here to help everyone. This called genital urinary syndrome of menopause. Greetings, everyone watching. I'm on the road going to pick up my son. Say hi to your son, Johnny Be Good. Tell him Dr. Ben said hi. I don't know if he wants to be a doctor one day, but if your son becomes a doctor, be sure you will be seeing your son once in blue moon. Like I don't know when I saw my mom, but we talk because I'm service to humanity. 14 people, please increase the likes. Now, when it comes to sexual changes, you have a reduced libido. Estrogen is reduced, libido is reduced. Pain during sex, we have said why, and reduced arousal. Skin and hair changes. Skin and hair changes. Skin becomes thinner, wrinkles increase because of what? We have said progesterone helps suppling and estrogen. Hair becomes thin and sometimes you get hair loss. It is called alopecia. And then when it comes to musculoskeletal symptoms, you have joint pains, muscle pains, and back pains. Yeah? And you know, when your hormone changes, you start interfering with This menopause is a very long topic. If you don't finish today, we will finish tomorrow. Now, when your hormones are changing in a woman, there is something called the parathyroid hormone, which balances calcium. So when it loses its balance, you start having osteoporosis. You start having problems with your bones. I think now you know why when you grow old, you can have a fracture so easily. You get it? Bone breaks down, increases, bone density decreases, and fracture risk increases. So you be on calcium and food that produces calcium. You get it? Common fractures are hip, spine, and waist. There is a common fracture called intertrochanteric fracture. Intertrochanteric fracture. Here at the bone, you just wake up and then you feel like you're falling down. It is called intertrochanteric fracture. Now, common fractures at the hip and spine because they, at your pelvic, that is where you carry the weight. You get it? And then you will increase cardiovascular diseases. Estrogen protects blood vessels. So they cannot collapse. They stay at how they are. So after menopause, you increase cholesterol, increase risk of heart attack, stroke, and atherosclerosis. Atherosclerosis means hard what? Atherosclerosis means hard blood vessels. You get it? Hard blood vessels. That is in cardiovascular. And then we have metabolic changes. Weight gain because of high cholesterol, increase abdominal fats, increase insulin resistance, because more of fats means that insulin resistance is there. The insulin that is coming out is not taking care of the sugars that you have. You get it? And then cognitive changes. Cognitive changes means you start having loss of memory like dementia and memory decline. And mostly you cannot go to a hospital and then you be diagnosed with menopause, mostly with blood works just once. No, you should have 12 months without menstruation first, and then in the laboratory after the 12 months they will check on follicle stimulating hormone and luteinizing hormone from the pituitary gland. If they are high and the estrogen is down, you'll be told you are undergoing menopause. You get it? So let's know that menopause can be categorized early or before, as we have said, or before the day of menopause or after. Now it is 1 hour, and if I start talking about management of menopause right now, I'm at work. I'm still at work. Imagine. We will not end this now. So tomorrow we will find a time, and I will talk about. I'll talk about. I'll talk about how to manage menopause tomorrow. Is there anyone with anything that can say my time is out? I have to look at some patients before I leave. I'm at night shift. Anyone? We will manage menopause tomorrow. Management of menopause is a very long, and my 1 hour is gone. My 1 hour is gone. Please, if you have a question, give me now. I'll manage. Let's talk about management of menopause tomorrow. Let's talk about management tomorrow. I'll put a link earlier so that the people that are interested can plan. I know it's raining. Where you are, I can't even hear you now. Where? Oh, it's raining where you are. Sorry. Tomorrow continue this menopause tomorrow. Yes, I'm in hospital and I have to see patients before I go home. I will let me check my diary tomorrow, get road, so that I post it earlier for early preparation. So if you, I post it in the morning after I've asked about my diary of the day, and then we can continue. So I think there is no question. Thanks for everyone who has listened to me. I think I've honored my promise of talking to menopause, but I've not finished. If we continue, it will take me 2 hours to manage. So the other 2 hours, let me manage it tomorrow. I know when I'm talking about management, many people will get help. Thank you a lot of being here and listening to me. I'll send a link on management. Everyone who is in Kenya, have a nice evening. Everyone who is abroad, nice day. I love you all, and let's get communicating. If you have a question, always don't be shy to ask. Stay safe, and the uh, men who are here, I've given you a secret of your women in menopause. I love you all. I love you all. Bye. See you tomorrow, guys, as we continue on management. Thank you so much.